questions as well throughout. So if you feel like we're not getting to your question, we will take time to be able to answer the questions. And if it's a question we can't answer right away, we will also looking for ideas on further webinars as well. So let's see. So Boricua, I was gonna read the slide like a professor. Boricua Resistance National Alliance aims to educate, organize, mobilize the Puerto Rico diaspora and all of our allies for liberated and free Puerto Rico. Okay. She is on the offline. Oh, I'm sorry. My thing wasn't showing up for, I selected my language. I'm telling you all to select the language and I didn't. Okay, so I hope that you were able to hear me. So right now, these are different chapters, and also when you donate to the Venmo, it goes towards certain things like being able to have these interpretations. So it helps our interpreters, and also it helps towards building that language justice. So we ask to please show support. Even just showing up in these is support, and also monetary support is always helpful. So thank you. And also to support our interpreters, please write to Babia and your donation for the 3 following Venmos. All right, so, oh, you know what? My thing keeps closing out my languages. I'm sorry. So my Zoom's being iffy. Okay, so will you put up the slide for the online school part 3? Will you share the screen? Okay, so yeah, online school part 3 coming up. We're gonna try to have them around the same time, so for consistency. And then we also have 3 speakers today. So our 3 speakers today are going to be Christian, Hugo, and Lisa, and we're really excited to hear from them. So let's jump into it. They're all very, very brilliant people, and we're gonna start off with Christian. Thank you, guys.
Christian, can you hear us? Yeah, you're good to go. Just unmute.
Ok, ahora sí. Buenas tardes a todos. Mi nombre es Cristian Santiago. Soy
Good afternoon to everyone. My name is Cristian Santiago. I'm a student of public health with concentration on epidemiology.
Okay. ¿Todos me escuchan bien?
Can everyone hear me?
Me gustaría que me contestaran, sí. Okay.
If you can let me know. Okay, great.
Okay, pues vamos a comenzar.
Okay, so let's start. My name is Cristian Santiago. I'm a public health student, epidemiology. And then today, we're going to be talking about COVID, the name of the coronavirus that's been given, and what it's looked like in Puerto Rico, and what's happening currently. So you get to know a little bit about that. And to start, what is the COVID? It is COVID-19. It is a new infectious disease that affects the respiratory system of the folks who are infected by it. And COVID-19 is the disease, which is how it's known, coronavirus. But the virus has been given the name of SARS-CoV-2. Before we were calling it nCoV. And the symptoms that it includes is the fever, is tiredness. These are the most common symptoms, and then a dry cough. in which we've seen already in the materials and literature. But if there are also other folks who report have other symptoms that we see here in the bottom part, which are aches and pains, nasal congestion, runny nose, sore throat, or diarrhea, among others. But 61% of folks who have gotten the virus have reported and described that they've had mild symptoms. 14% describe that they've had severe symptoms, and 5% of folks infected have said that they've been in critical condition. These are folks who have been infected and have been in, the folks who have been in the severe critical symptoms are the ones that go to the hospital. About 81% who have mild symptoms are usually folks who don't feel severe, because they don't feel severe symptoms. Right now in Puerto Rico, for instance, everyone is quarantined, and those folks are in their homes. But we can go to the supermarket, we can go to the gas station. So these folks who have these mild symptoms, if they're infected, can be in the community, and they don't feel the need to maybe get tested or go to the hospital. So that makes them very infectious. And how is COVID-19 spread? COVID-19 is spread around these droplets, in English. When a person coughs or sneezes, these little droplets, these particles, they travel in the air. And if you're in direct contact or you're less of a distance of 6 feet, then you can inhale or breathe in through your nose or mouth these droplets and get infected with the virus, which is why it's really important, and which is why we recommend it to folks that if you cough or you sneeze, even though you might think you're not sick, you should cover yourself properly while coughing to make sure to avoid to not infect someone. And so the literature has reported that COVID-19, if a person sneezes or coughs, these droplets can also land on a surface. And afterwards, if someone touches that surface and then touch anything that's part of your respiratory, your mouth or your nose can become infected. And I want to share here in the bottom of the screen that you can see on the bottom left part, you can see a study here that reports how long the coronavirus is active in these surfaces. And I want to emphasize that this information that I've seen people have shared, but to say that is of COVID-19, and I want to show you that it's not COVID-19, it's coronavirus, which are different types of coronavirus. And among them, you have SARS, MERS, there's other coronaviruses that affect animals, for instance, which you can see here at the bottom right-hand corner of our screen. In this study, they used the MERS, the SARS, the other different types of coronaviruses, and they study the duration of how long these viruses can exist on surfaces. And plastic, they can be about 5 days, stainless steel, 48 hours, wood, 4 days, and then as you can see the rest. But it's really important that currently universities are not doing research on this virus because it's a mild virus, but we're having a pandemic. We're in the moment, so it's urgent. So they're not able to study it with the amount of time that's necessary. And then so the research that we have seen so far, we've seen that the virus can last a few hours, including maybe even days on surfaces, right? So it's really important that we take the preventative measures specifically the ones that have been recommended. So washing your hands with soap and water. And this virus is an RNA that's encapsulated in a protein. So when you wash your hands with soap and water, these proteins break down. The capsule of the virus is broken down, and it can't live. It can't survive outside of the protein capsule. So So it's really important to use hand sanitizer also with at least 65% of alcohol. And this is complete, like as the whole percentage relative to the hand sanitizer. And then when you put on the hand sanitizer within your hands, your fingers, your nails, and the palm of your hand, and the inferior and superior part, and you let it dry. You don't dry it off with any other fabric or with any other towel or with any other paper. You let it air dry. And the most important is avoiding to touch your eyes, your nose, and your mouth. And why? Because this is the main entrance for the virus. You can maintain distance, you can be by yourself, but if a person, let's say, you can go to the supermarket, you can go to the gas station, and let's say that you're by yourself on your gas station and there's no one there, you're lucky. But if someone that was there before you was infected and they sneeze and they coughed, they sneezed, and they touched the pump to pump gas, then when you go, you trusted that you were alone, you didn't take the precautionary measures, and then you touched your nose, you touched your eyes, you touched your mouth, then from there, you have a higher risk of getting infected. And as I mentioned before, to take the best respiratory hygiene measures. And if you're gonna cough, use your elbow or your shoulder, use a fabric. If you use a fabric or paper, make sure you throw it away right away. And in this moment, it's recommended that you're using a paper to throw it out right away. And unless you're home and you're using a fabric constantly, and you can wash it. And it's really important right now, the social distancing that we've heard of and staying in our homes. Okay. And now that we saw the introduction on what is COVID-19, I want to establish a timeline throughout.
To see how it has shown up in the world. And after this, we got to focus just on Puerto Rico. So the first case was described to be on December 2019. I wrote 2020 in there, but it was 2019. It was at the end of last year in 2019 when we were seeing these reports of these cases in the world. Basically, these were precisely in Wuhan, in China. And then the cases continued slowly rising, and they were expanding all over China. And as we know, the World Health Organization, which focuses on these issues, with health issues on a world level, they declared a public health emergency. So on February 26th, the World Health Organization declared the situation to be a public health emergency of an international concern. It was a public health international issue. So what can one interpret from that? You can interpret that as that it has spread to such level that it's in different countries. And so first responders and leaders of each country is sort of on alert for the countries to sort of start getting ready for what might come to their shores. So even in that moment, the president of the World Health Organization didn't use the word pandemic. And why was that? Because we've seen that in similar events before, that when we use the word, they use the word pandemic, this causes anxiety. Sorry, I just saw a question pop up. So we've seen them in previous events where when they use the word pandemic, it creates anxiety, it creates panic in the population. So then the World Health Organization decided to not use the word pandemic up until that point. Later on March 9th, the president of the World Health Organization used the word pandemic. And then we're sort of understanding that it's a serious event and it's getting out of hand for them and other countries. So then it's not until March 11th that in writing, it is declared to be a pandemic, a COVID-19 pandemic. Okay, so in Puerto Rico, what was happening during this time? In March 2nd, 2020, the Secretary of Health said, the Secretary of Health of the Department of Health in Puerto Rico said that the island is prepared to attend any emergency caused by the coronavirus through 68 hospitals and 380 beds. So he shares these words after some weeks before it had been reported that in 1 week there were 1,000 cases of influenza in Puerto Rico. So infectious disease like influenza in Puerto Rico, for there to be 1,000 cases of influenza in a week, and for him to think that with 380 beds you can then solve something or deal with the issue, it's a little surprising for people who know about health situations in Puerto Rico. So those 380 beds are not any beds. They are isolation rooms which have negative pressure, which means that the air that is inside that room is not going to exit into the hallways, but it's going to go through a process in which it's filtered, and then the air and the particles, the droplets, won't leave that room. So moving on March 8th, this is an important day in the timeline for COVID-19 in Puerto Rico because two significant events occur. The first one is that an Italian woman, there's a cruise ship called Costa Luminosa with a patient. It was a cruise ship called Costa Luminosa. This cruise ship arrives in Puerto Rico on Sunday, March 8th with a patient who had pneumonia. That's how it was described by the health personnel in the cruise ship. There wasn't any suspicions from the medical staff in the cruise ship where they thought that it could have been corona, even though that everything that was happening, even though that person was coming from Italy, there wasn't any suspicion. So the patient was transported in an ambulance to a hospital, and upon seeing the case, the doctors in Puerto Rico make the decision to test her. So this was the first suspected case in Puerto Rico. That same day, there was a music festival that happened, a salsa music festival that happened, where thousands of people go to this event. And between those thousands of people, there was a person from Panama who, days after the festival, tested positive. I'm not sure if it was the day after, but what I was surprised about in these news was that this person, even with symptoms, they still, from doctors say, he felt bad and he left Puerto Rico. He goes to the airport with symptoms. He gets to Panama with the symptoms, and he's not stopped at any moment. So folks who have been keeping up to date with this COVID-19 situation are surprised because the CDC had mentioned that in the airport in Puerto Rico, they had a surveillance station for all folks who were arriving to take their temperature, to ask them questions to make sure that maybe it could be a suspected case or not. But he demonstrates, this Panama person demonstrates that wasn't taken into effect then. I also know some folks that were traveling during that time and coming in and out of Puerto Rico. They say that there was at no moment any appropriate measures being taken with people that were arriving. So these two people, the first one, the Italian woman, her and her husband were hospitalized. They were isolated for being suspected cases, and they were tested for COVID-19. In regards to what happened with the Salsa Festival on March 11th, which is when we then do know that this person from Panama tested positive and was in Puerto Rico, then the governor, Juan de Vázquez, recommends that people that went to the music festival distance themselves socially for 14 days. This is for folks who might be presenting symptoms at the time. I hadn't mentioned, but the incubation period of the disease is about maximum. Well, we've seen that it's sometimes in some cases it has been longer, but usually it's within 5 days and 14 days you have an onset of symptoms. And these people that went to the festival were the people that were asked to stay at their homes, were not penalized in any way. So the samples that were taken from these two patients, the Italian woman and her husband, those results weren't shared. Well, the test wasn't ready. The results weren't ready until March 13th, which is when the CDC confirms that she had COVID, her husband had it, and another patient who had been in contact with his daughter, who had been traveling, and apparently she had symptoms, and she was the one who infected her father. So from March 13th, we start seeing reports of cases in Puerto Rico. So after this then takes us to what is known as this takes us to the lockdown in Puerto Rico, which happened on March 15th. The governor established a lockdown for 14 days, where the only thing that remained open would be, and it was established on the March 15th, was supermarkets, financial institutions, gas stations, pharmacies, healthcare centers, or that take care of elderly folks. Any other centers that distribute food, medications, medical equipment, or fuel can be open, but these spaces can only be open for the public from 5 a.m. to 9 p.m. 5 a.m. to 9 p.m. Everything else is closed right now. It's working right now. Recently, we were arriving to the end date. I think the 14 days were ending on the 30th or the 31st of March. So since we were getting close to that date, so the governor sent out a new message, which was indicating that lockdown was going to be extended with some modifications. So the new ones are that everything will be closed on Sunday, saying that no one basically can leave their house on Sundays. Vehicle registration plates that end in pair numbers can drive Mondays, Wednesdays, and Fridays, and in-pair numbers can drive Tuesdays, Thursdays, and Saturdays, but only between 5 a.m. and 7 p.m. It's important to emphasize that vehicles that are on the street can only be transiting, or if they're gonna drive somewhere to look for food, or if they're gonna go to the supermarket, or if they're gonna get gas, or if it's an employee from these places, hospital employee, supermarket employee, works for the Puerto Rican police, and that. So they can only walk around around 5 a.m. and 7 p.m. So now, since, as I mentioned, from March 13th, there have been cases being confirmed in Puerto Rico. I wanted to share this with you because these are public labs that are right now. The previously health department was the only place that had control of the tests that were being done in Puerto Rico. First it was CDC, then they opened up a lab in Puerto Rico. At that moment, the health department had control of those samples of the tests that was being done, and now they're almost running out of tests. And only the health department was the one who could authorize to have a test done for the patient. Then this was changing as days passed. Health department authorized medics, doctors, that if they saw cases of the suspected to be COVID-19 cases, they could then administer the test. But then presently, besides the health department, the Veterans Hospital, And there are private labs that are doing these tests in Puerto Rico. I want to share with you this image because these are some of the labs that are offering the test, but it's important for you to know that if you read at the bottom part, it says that everyone that is going to take the test needs to have a negative result in their influenza and mycoplasma tests. So these are diseases that could confuse the results, or could be confusing because the symptoms are similar to COVID-19, and that is one of the reasons why they're asking for that. The second reason is because there aren't that many tests. At the beginning, they have been offered equipment to the health department to take on 1,000 tests, but now those tests are dwindling. So they want to make sure that they're administering tests to folks who are highly likely to give a positive. So they want to discard and dwindle down people who might have a negative results, and also mycoplasma. So a problem with that is that a person can get infected via mycoplasma, can have the symptoms, but then they can give a positive result even 90 days after. So for example, let's say someone got infected in December or January, let's say January, with mycoplasma, they can get infected again with COVID-19, and to take the mycoplasma test, they could get a negative, and then what they have is really COVID-19. So these are the statistics. Right now, I'm gonna show you the actual statistics in Puerto Rico. Almost all of them have been updated yesterday. So then some of them I updated today. But you can see that. So the three centers that are doing the tests are the Health Department in Puerto Rico, Veterans Hospital, and clinical private labs. So up until yesterday, we had 69 cases confirmed, and today, from 79 cases, we have 100 positive cases. So these are results that are recent. Are 1,631 are tests that have been carried out today, and the 100 positive cases have been the ones found up until this date. From the tests that were carried out until yesterday, most of the tests were carried out by the health department, as we can see on the graph. Also, in the confirmed COVID-19 cases that have been found by the health department, we've seen that 56.40% of the cases that have been positive have been men, and 43.6% have been women.
What we can observe here is the range in which the positive cases have fluctuated, reported by the Department of Health up to yesterday, March 27th, and the average is of 57 years old. And as you can see, they tend to be more cases in which folks are over 60 years old. And it's important to emphasize that because the population at risk are folks who are over 60 years old. It's also people with high blood pressure, people with cancer or history of cancer, high blood pressure, diabetes. There's chronic illnesses for the most part. And that's how we've seen the cases that have been reported in Puerto Rico up to today. On March 13th, there were 3 cases. And then afterwards, you can see how we've observed the different cases being increasing. As of yesterday, we had 15 cases reported. Today, we had 21 cases reported, and that was this morning. And with this, now we're at the 100 confirmed cases of coronavirus. And then as far as the different regions of Puerto Rico, these are the 7 regions of health and how it's divided by health. we're seeing the metropolitan area with the highest number of cases, which is as of yesterday. Today, the numbers will change. And the metropolitan area had 36 cases confirmed. Then we had the Mayagüez region, which had 13 cases, and then the Bayamón region and Arecibo that we had, I'm sorry, Bayamón Caguas, that had 11 confirmed cases. And this is as of yesterday. Today, the cases are continually increasing. And then, so what to expect? I want to share with you all these estimates that a demographer, his name Raúl Figueroa, and these estimates that he has made, they're informed by two epidemiologists from Puerto Rico, Dr. Melissa Marzán, that works at the same university I study, and the epidemiologist that's part of the medical sciences in the public university here, and her name is Dr. Cruz Maria Rosario. And their estimates are that in the next 12 to 18 months, we can expect between 16,000 to 58,000 deaths. This is really surprising now that in Puerto Rico exists about 56 to 78 hospitals currently, and it only exists about 8,000 beds in Puerto Rico for patients. And as I mentioned earlier, about 356 isolation beds, for instance. If we expect this to be the estimates for Puerto Rico in the next coming months, well, it's going to be hard. It's intense. And also, the demographer also estimates that there could be 30,000 to 50,000 patients who are infected simultaneously in hospitals. And as I mentioned, in Puerto Rico, we only have 8,000 beds for patients who are sick. So this is what we could expect. And I'd like to share that these estimates that are being made by comparing numbers and facts that they've reported in other places, like in Italy, in Spain, Iran, in China, and now in the United States, which we've seen that the cases are constantly increasing. With these numbers are comparing how coronavirus has behaved in other places and other countries and territories. And it's important, it's also to give attention that demographers and epidemiologists are also not taking into consideration the prevention methods that folks are taking, like the isolation, like the social distancing, that folks always wash their hands with soap and water or with hand sanitizer, or that they avoid touching their eyes, their mouth, and their nose. These numbers could be lower, actually, and I expect that I hope that we don't get to that many deaths, but it all depends on the action that each of us as a citizen take. And these are my references. And with this, I'm wrapping up. And then so before, I wanted to thank Miguel Albero and Javier Pinheiro, who invited me to participate. If you have any doubts or any questions, thank you, Cristian. Well, we have a few questions here. I'm going to start with the first ones that were asked. We have a question about the order that they, the regulation that they implemented about people who were coming out in pairs. What happens to folks who don't have cars and take public transportation? Currently, public transportation is not active. So in Puerto Rico, the bus is called like the AMA. It's not currently functioning. And folks who depend on other people in this moment, well, they're not taking into consideration these factors. And also, I'm assuming that medical professionals And those folks who are working as fire people or police people, and it doesn't matter. The license plates and like in pairs doesn't affect them. Have there been testing done in Vieques and Culebra? Are these municipalities included in the data? In the data, they are, but currently we haven't seen any suspicious cases in either of the islands. But in the past Secretary of Health, who is no longer there, who quit, has said that that if there were cases, that they weren't going to bring them to the larger island of Puerto Rico, they were going to keep them isolated. Okay, thank you. And we have another question from Cristal Cruz that I'm going to read it directly. Has anyone thought of sending tests to the archipelago that could be managed by communities? Do you think that's something that could happen sometime soon? Soon, I doubt it. Why? Because this is a global situation. We know that corporations are the ones producing these type of tests and to distribute them to all the countries, because the reality is that there is a need for these tests in all countries. In Puerto Rico, we have asked for, they had ordered 200,000 tests and recently 3 million tests. And then it would be ideal that everyone should get tested because having a diagnostic, even if you have mild symptoms, if you know that you're infected, you can stay in your home and you're not infecting anyone or exposing anyone, and without it being able to continue propagating throughout the communities. But for the time being, before getting to the communities, they could potentially get to, or clinics that are in the communities, the Department of Health, from what we've seen so far, wants to have control over this. And in some time, there was some resistance in that at the lab, the clinic, the labs and the clinics would be the ones providing the test, but now we've been able to accomplish that. So now we have some labs, some clinical labs that you can go and get tested. If it's a rapid test, for instance, it's through blood work. And if it's a test that takes longer, then it's with something that they insert into your nose. And what has happened with folks who were victims of the earthquakes and are displaced? Well, currently there are people who are in different shelters in the southern part of Puerto Rico. And the truth is that, I'm scared. I hope we see no more tremors or earthquakes. And so that's, and with the current situation right now with of folks with isolation, there's a higher risk if people go outside, right? But there are currently people who, I think the last number that I'd heard is less than 400 people who are currently in shelters. But yes, that I have knowledge that, yes, that there are folks that are still in shelters in the southern part of Puerto Rico. And then in terms of data, I'm going to try to combine several questions. If you need more information, we can give more details, but it's so we can continue to the next presenters. Any questions that we haven't answered, I'm going to write them down. So then afterwards, so we at the end of the presentation, when we have the Q&A, we can still ask the questions. And so this question has to do with the data again. Have they counted any case of a person who are non-binary, who are gender non-binary or queer? Because you mentioned a binary data for males and females, or women and men. So I wanted to know if we are counting the queer community in this data, and are they still testing folks only with symptoms, or folks who have been traveling to places to the countries that are high risk. Which was like about 2-3 weeks ago. So in terms of what you were asking, this data, I got them from the Statistics Institute in Puerto Rico, who have gotten the information from the Department of Health. So at the moment, no, they're only reporting if someone is a woman or a man up to that point. And then, I'm sorry, what was the second question? The second question was regarding who is getting tested, for instance. Are folks who have symptoms initially they only wanted to test. So hold on, the definition of a disease, for instance, for COVID-19, as we know, they started reporting cases in China. So initially, before anything else, before we had a positive case in any other country, the definition of a case, for instance, or a suspicious case is having traveled to China recently. And then so that definition included that to be more precise, the location Wuhan. And then so that has been changing with the definition. And this always happens when it's a new disease. So in Puerto Rico, it included initially that the definition of a case meant that the people got tested of folks who had traveled to the countries like China, Iran, Italy, etc. And then that would also show some symptoms. And it was very specific with the symptoms that they had to have 3 symptoms: fever, dry cough, and I think congestion. They had to be congested. And currently, now that definition, that case definition has been changing because we've observed that we've had the community spread, which we've observed is already in Puerto Rico. So they're already testing folks who have symptoms and folks who have lab results for negative for influenza. Well, thank you, Christian. And we're going to continue with Alexandria. If you want to present the following folks.
Sorry, Alexandria, it's all you now.
So if you have any other questions, you can write them in the chat and we can get them set. We can speak them out.
Okay, and next up we have Hugo. Can you hear Hugo?
Yes.
Thank you.
So, hi to everyone. Are you listening to me? Is everyone listening clearly? Okay. First, I would like to say thanks to people at Boricua Resistance. We believe some of us believe in solidarity, and sometimes being in social isolation feels like the opposite towards what we believe, that is getting people together, and this opportunity of having you, at least virtually, everyone in their houses or wherever they are, I think it's one step towards that union of people and getting together in some way. First of all, I would like to say that being in Puerto Rico for the last 5 years, if you have been living here, it feels sometimes like you are in the season finale of a mystery or an action series, because we have been through so many things at quite a fast rate. So if you want to analyze how education has been affected in Puerto Rico, you have to understand that everything that has been going throughout the world In Puerto Rico, you probably have to multiply by 2 or by 3 and added a few other important things that has been happening in Puerto Rico. I'm going to show my presentation. So to present myself, my name is Hugo Delgado Marti. I am a physics teacher here in Carolina. I belong to the Socialist Workers Movement, which is a socialist organization that fights for independence and socialism in Puerto Rico. Also, I belong to the Puerto Rico Teachers Federation, which is the union, or the most militant union here in the island. It's not the union that represents us in the bargaining. That's actually the Asociación de Maestros, which is another union. But we actually try to be in a minority union to continue the struggle for not only for better rights for teachers, but also for, I'm sorry, yeah. I'll try to speak slower. The Puerto Rico Teachers Federation not only fights for better rights for teachers, but also we like to improve the quality of education. We fight for public education. In Puerto Rico, the Constitution grants the right for public education. So we like to keep it that way. And that has been one of the key aspects of our struggle here, is to maintain education as public and as high quality as possible. Let me see if I can move yeah. So to talk about the situation in education, we have to see how all the other aspects that have affected our situation here have also affected education. For example, in the last 5 years, we've had not only Hurricane Maria and Irma back to back, and all the effects that we can once again talk about them, but also every once in a while we have we lose classes due to warnings or small storms that affect education. And the important about this is one of the problems that we're having is the time of contact that teachers have with students. We are losing a lot of time, not only because of the hurricanes and the hurricane activity, but also because we had recently, just a few months ago, a surge in seismic activity in the south, and we were outside of our schools for mainly most of a month. We couldn't go to schools. We were in our houses trying to stay safe. Some places like Guanica in the south didn't ever actually start school because many of the schools in the south were actually destroyed, totally destroyed. One of the schools collapsed, and people were afraid that the schools would collapse on us, and we didn't believe the government when they were trying to tell us that schools were safe. We had a situation where schools were being observed by experts. That took the month of January and some part of February. So when we went back to school, we only had like 2-3 weeks of school during this semester. Add to that Puerto Rico has been living one of the most profound economical crises in its history, maybe since 2005. Since 2005, Puerto Rico has gone through several dips in its economic numbers. We have a high level of unemployment. We have runaway factories that have been leaving the island. We have a decrease in our population due to immigration, particularly because of the unemployment problem, but also because of the other problems that we see in our island. That economic crisis is tied to the political instability that has been brought by the economic crisis. I don't know if all of you know that we, during the summer, had a very active summer where we actually removed one of our governors because we discovered that the way they were handling our resources in Puerto Rico during the hurricanes and during the emergency situations was used for their profit and not for the benefit of the people. Many of the resources that were brought to Puerto Rico got lost or were found hidden in warehouses. Just a few months ago, someone found a warehouse in Ponce, full of resources that could have been used during the Hurricane Maria. And we know that of the thousands of people that died, many others went through a severe situation where many people didn't have access to water. Some other people didn't have access to gas to use their stoves. Others didn't have access to beds or tarps for their ceilings. So that all that political instability also affects our education, because we have constant changes in the way policy is applied in schools. And we can say that many of the attempts to change our, at least the way we do things in our schools is being affected by this political instability. Changes in government, changes in governors, governors that are inept and that do not know how to even do the most basic things, like having transparency in what they were trying to achieve. At the same time, Puerto Rico, being a colony of the United States, does not remove the fact that we are extremely close to a third world country in terms of poverty and disparity in access to opportunities. The depth of corruption in our government also affects the way resources are driven into schools. We have schools that lack sometimes the most basic needs, like toilet paper. We've seen how in the world right now with the COVID-19 outbreak, people are running to buy toilet paper. Well, in most of the schools in Puerto Rico, the bathrooms do not have toilet paper. Either the teachers buy the toilet paper or the students bring their own toilet paper. And in rare cases, some schools do have a little bit of toilet paper once in a while. And that, not only toilet paper, I'm talking about supplies for cleaning schools, brooms, detergents. Sometimes even a single marker it's not made available. And we know that the resources are there in the Department of Education. It's just that corruption makes it that it doesn't get down to the schools. We teachers don't see sometimes that the use of resources correct. At the same time, unemployment is another big issue here in Puerto Rico, because the lack of employment and the lack of opportunities is shown that it's really close to how people use it and benefit from education. If in your house you don't have access to computers, if you don't have access to the internet, how are you going to solve the main problems in your house? If you, sometimes students don't even have access to nutrition, a correct nutrition. Parents that have to work late hours and that cannot dedicate time to their children. So all this at the same time brings together what is the recipe for a catastrophe in the education system. We teachers are being evaluated all the time about the way our students do their work in the standardized testing, but that standardized testing doesn't take into account how many of these things affect the way we do our work with students. Finally, I have to talk about violence. Violence in Puerto Rico has many different ramifications. One of the ones that I would like to emphasize is gender violence. I've had, for example, students that have to be removed from their schools because they have a violence in their houses, because there's a violent person in their house that they have to be isolated from. We had the case of Alexa, a transgender woman who was shot just for being transgender. She was a homeless transgender woman who wandered around because she didn't have opportunities, and it was viciously shot by someone in the street. And she was the victim also of cyberbullying, where the lack of understanding of transgender people and the religious and outdated views of some people were brought this catastrophe. So all this together is the situation we live at right now here. And when you're trying to educate and when you're trying to bring your students to a high quality education, sometimes it's really difficult, because you have to talk with students about all these other situations that are happening, because that's what they are actually living. And I'm a physics teacher, but I cannot stop talking about the economical crisis because that affects them. If tomorrow the school is going to close because we have a COVID outbreak, I'm not a biology teacher, but I have to talk about the virus and I have to understand the virus. Yes. So what I'm trying to get to is that education in itself, it's feeling the effects of all these crises around it. And we're losing a lot of time because of all the problems that we have been going through this year. And that makes it really difficult to maintain the high quality education that we want. At the same rate, we have a government that has shown a lot of improvisation in the way it attacks the virus outbreak. Christian talked about the Día Nacional de la Salsa, the salsa concert or festival, where thousands of people, not only from Puerto Rico, but throughout the world, go to the Roberto Clemente Stadium. They dance. No, there's no way, if someone was infected, there's no way that most people there got infected. The way the people interact in a salsa concert is not seated and as maybe the governor expected. So there were students, there were teachers in that concert. So when we went back to school, many of us were worried that schools should have been closed that first week. I think that was one of our first mistakes. I think schools were not attended properly at that time. We were never trained on how to act about this outbreak. At the same time, the week before, I was talking to my students about the flu outbreak we had. I had a whole group that maybe 10 students were not sick. Out of my almost 30 students, maybe 20 were absent that day because they had the flu. So imagine what would happen in that place if we had at least one student who had gone to the salsa concert in a high school of maybe 1,000 students right in the middle of Carolina, a highly dense populated area. And now project that towards the whole island. There was no control. There was no protocol on cleaning the surfaces in schools. So that improvisation and that lack of transparency sometimes brings the worst in, or people do not believe what the government says and are skeptic about following the rules that the government imposes. If you don't believe in your government because you think that your government is trying to act only on the individual needs of the governors and not towards the needs of the majority, people are not going to stay in their houses. So that's one of the problems we have with this outbreak, is that belief in the system is so weak that when you need people to believe in that, people do not actually follow the rules. So I've seen a huge reduction in traffic outside in the last few days, but I think that at the beginning, that week after the first case from Panama, we should have begun all the protocols that began actually 1 week later. So that response from the government has been slow, has been skeptic, and I think that has taken us to the point that where we are now, that we have 100 cases of people infected. As I said, our government prioritizes in profit, not on the people. And that's the way we feel that education is being treated. Right after we were called to stay at our homes, project of law was sent to Congress, to local Congress here, to Senate and the Representative House, to approve a new law which would privatize distance learning in the Department of Education. They wanted to approve a system that will be private education through distance learning. So in certain way, they were trying to remove us as teachers as the contact with students and give that to a private corporation. And as we like to say here in Puerto Rico, to the soul friends, amigos del alma, that's an expression that a politician used once on record, that they give their contracts to their friends and to their family. Teachers, as a matter of fact, do not have in Puerto Rico the proper training to at least do something like this. I don't think the majority of teachers even know about Zoom, let alone they know about Skype. And some of us are technologically savvy, and we try to do our best, but I don't think the Department of Education has ever dedicated resources to make teachers learn how to use the technological resources properly, because the priority has always been teaching to the test, educating teachers about standardized testing, not about using resources towards diverse and using many tools, and the tools using them more effectively. And that's one of the difference that I have with the Department of Education. If a technology comes up and it looks wonderful in paper, they will promote that everybody gets it, but no one ever analyzes how it is going to be used, how it's going to be the proper technology for what case. It's not used as an education tool, it's used as a profit tool. And that's the way education works here in the island. Not only we do not have the proper training, but many of us do not have the proper equipment. Right now, my laptop, the only laptop that I have, all my other computers are damaged because of the electrical problems here we have in the last few years. The ones that I bought with my money are broken. The one that I have that's given by the Department of Education is from 2009. The one that I'm talking to you guys right now, this is a 2009 computer. I have, I think, Windows 7. That's what the Department of Education gives me. It's really sad when you go to schools and you see computers. We do not have control over them. We cannot install anything on them. We cannot, sometimes we don't even know the passwords because there is not a system on how to use technology. They buy the technology, but they don't give support to the technology. They spend the money, someone gets the money, but the technology never actually reaches the student. It barely reaches the school. And the biggest problem of all is that in Puerto Rico, we do have internet. Puerto Rico is probably one of the Latin American countries with more widespread internet capacity, but that's on our own. We have to pay the internet with our diminished salaries. So some of us feel that that's a bit unfair. I have to use either the internet that I have in my cell phone that has limited data, or the internet that I have in my house, which is not as powerful as it should be. And the problem of the salary is we have a salary, the teachers in Puerto Rico. The salary of a basic teacher is monthly, $1,700, $1,750. That doesn't amount even, I think, to 20 grand a year. And that's the basic salary of a teacher. And with all the teachers retiring, all the older teachers retiring, most of the teachers probably now in Puerto Rico are on the lower spectrum of the salaries. I myself don't earn $2,000 a month, and I've been working for almost 15 years as a teacher. So you have to see that means that the salary that I have to, if I have to spend my salary on the resources to do education, it's a bit unfair because there's people earning the money that should go to education and using it. So that makes teachers bitter in order to at least use their resources to continue working. Sure. Okay. As I said before, there have been attempts to privatize schools in Puerto Rico. We have in our constitution that schools in Puerto Rico have to be public and cannot be religious. They have to be, they cannot be religious of any kind. The department cannot spend money on religious institutions that do education. That's in the constitution. But the federal law has driven Puerto Rico toward privatization. The No Child Left Behind, and right now the ESSCA, we think are means to privatize education. And the people who make policy here in the island are driven towards privatization because that brings a lot of money to Puerto Rico. If you privatize schools, you are going to get a lot of more resources, but those resources come at a cost. If you increase privatization in Puerto Rico, you are abandoning the control that we as teachers have over that education, and not only teachers, the people of Puerto Rico. Content is every year more restricted. Freedom that I have to teach. There's a curriculum that I have to follow, and we understand that. But every year that curriculum is just left on paper, and we are given activities that are directed only towards standardized testing and only towards those subjects or those questions that are going to be tested. At the same time, the economical crisis has driven the governors of Puerto Rico to close as many schools as they could. Right after Maria, with the emigration that we had, thousands of people left the island, many of them students. Some left because schools were closed for months. Some of them wanted to continue studying, abandoned the country, went either to Florida, New York, and other places. And that meant that the number of students in Puerto Rico reduced. And we understand that there was a reduction in the number of students, that we recognize, that we accept, that is true. What we teachers don't think is evident truth is that the reduction in the number of students justified the school closures. You could have used the reduction in students, in the number of students, as a way to improve the quality of education. If you have less students in a classroom, you have a better way to reach every student, particularly in our system where more than half of our students are special needs students. More than half of the student population in Puerto Rico are special needs students. So school closures was a neoliberal agenda where they only wanted to give in paper the appearance of attrition, of reduction. There was no reduction in the amount of money spent on buildings, on schools, on maintenance. There was no reduction on the number of teachers, only those who retired. But the school closures didn't actually mean a real reduction in budget. It only meant an increase in the amount of students per teacher. And they like to use statistics to play games. And for example, if you have a librarian doesn't have students that account to them, or only them. There should be at least one librarian per a whole school. So you have to divide the total number of schools, because the total number of students, to that librarian. But the way they do statistics here is that they take librarians, they take counselors, they take social workers, they take all the other people that give services that do not have a classroom. And when they do the statistics, they say, Puerto Rico has too many teachers. Puerto Rico has the highest amount of teacher per student ratio in the world. And it is actually that we need those teachers, we need those counselors, we need the librarians, we need the physical education teachers, we need the art teachers. A school is not only about English, math, science, and Spanish. So school closures was actually a political way to eliminate schools from certain communities. We even discovered that a few of the buildings that were closed were actually seismic resistant, and the schools that were still open were not. So some people have theorized that there was a gain here to use those buildings for privatization of schools, and to use those that were much better buildings than the ones that remain open, as a way to open private schools, charter schools in all throughout the island. I think we had 1,500 schools, maybe 20 years back. I think we're down to 800 schools throughout the island. I have almost 30 students per classroom. So there's a disparity in the need to close schools and the amount of students that we have now in each classroom. There's a situation in my school where some teachers don't have a physical classroom. They have to rotate. That doesn't make sense if you have schools that are closed. That means you are not planning how to use school policy correctly. That means you're making it work badly in order for you to talk bad about schools and to continue with the privatization. The other problem we have with education here is the history of corruption. We had a Secretary of Education, the infamous Julia Kelleher. She was arrested and she's being prosecuted for at least 2 cases of corruption that we know of. We believe that there are many more. One of them was dealing with a developer of community in Santurce, where she actually sold a piece of the school, of the terrain of the school, in order for the gentrificator to broaden a road and to open a walkway towards a park that they're going to build. So she exchanged that piece of the school for an apartment for her. And that's what I'm saying. This is the one that we know of. And the size of the chunk that they took out of the school is really small. We only have to imagine how many other negotiations were there between her or other members of governments dealing with schools and which other privatizers. So, but when you go to the history of Puerto Rico, all the way back to Victor Fajardo in the 90s, which was the Secretary of Education during Pedro Rosselló governorship, all that history of corruption in Puerto Rico is really tied to the influx of federal funds here in the island. And sometimes we like to say that corruption and privatization go hand to hand. Corruption and federal money go hand to hand. It is not that people here in Puerto Rico are deviating from their honest cause and agenda. No, it's that the federal funding is geared towards corruption. Privatization only brings corruption because someone is going to benefit from the funding. And it's not going to be the students. It's not going to be the teachers. It's going to be the private corporation. And finally, there is a struggle in Puerto Rico. We are trying to fight against corruption in many ways. And that's what I wanted to emphasize. We're fighting directly. We're fighting against the law, the law number 85, which brings the creation of charter schools in Puerto Rico. We're trying to resist in the schools, not only in the fight against the government, but also in the schools. All the schools that were attempted to convert into charters have resisted. The communities have organized and have resisted privatization. They have speak clearly against it. But that's not the only way of fighting directly. We also have to fight with our work every day within the classroom. And there are many initiatives, not only the direct struggle, but also the work that we do in our classrooms. I myself began after summer with a few colleagues from different parts of the island, an initiative called CurriculoCombativo, where we try to develop new content, new education content that's driven towards solidarity, towards against privatization, to recognize ourselves as people who have an importance in democratic and resistance, in democracy and resistance. And we're trying to do that not only in history and Spanish, but also myself as a science teacher. We want teachers to know that they can bring politics into the classroom. And I know that sounds difficult for some people. I know that not everywhere is equally possible, but we're trying to do it. We're trying to bring politics, but not dogmatically. I'm not going to tell students what to think. I'm going to aid them to think critically, and I'm going to give them the tools to understand nature and understand reality critically, so that they themselves can actually, as a teacher should actually do, construct their knowledge and a new creative and solidarity and in a progressive way. There's another attempt to fight against privatization, which was the project of open schools that occurred in the South particularly, where people didn't even have where to live. Some schools had been destroyed, collapsed entirely, the structure collapsed entirely. But the teachers organized and they brought tents where they will rotate and do activities and classes to students. They were not required to do so. The initiative began as an autonomous organization of the teachers. Afterwards, the Department of Education used a similar structure where teachers will talk to students in tents and make it in such a way that it's actually workable. But the initiative of open schools is a way of taking back the school and running it ourselves, not letting the government or letting a private institution tell us how to continue educating our students without their help. So we can do it. We as teachers can organize us, and we can do it. The struggle for democracy in school. We in the Puerto Rico Teachers Federation fought long for the right to organize the distribution of resources in schools. We lost that legally, but we're still doing the fight in the schools. We're trying to do the organization. And when I do mean organization, what I mean by organization is the way, how many students, how many teachers, how many classrooms, which courses, the length, even the length of the school period. That should be an education and and a teacher's decision, a political decision, not an economical one. It should be based on what do the students need. Do the students need 50 minutes? The Department of Education wants us to do 1 hour classes. The problem with 1 hour classes is that you have only 6 periods throughout the day. If you do 50 minutes, you get 7 periods throughout the day, which means 1 more class, which means an elective, which could be arts, which could be sports, physical education, could be music. And the Department of Education is trying to remove all the supplementary courses, which are the ones that students actually like, that students actually look for. And that's a way of actually destroying culture. And that's one of the objectives of neoliberalism, which is destroying culture. And schools produce culture. And we want to produce even more culture and a different type of culture. Another important struggle to remain public is the retirement system, the pension fund. And I know it sounds far-fetched, but there's actually a reason for that. Retirement should be an option. Teachers shouldn't be disposed because they're old. And there's a view against ageism, I think is the word, where one of the reasons they're trying to dismantle the pension fund is politically. They wanted to get rid of all those old teachers who have a lot of experience in the struggle for public education. And I think it worked. the fear to lose retirement has driven many good old teachers outside, and the way they're treated, they're rejected by sometimes even their peers. It's a way of actually it's like shooting ourselves in the foot. We're gonna be the old teacher one day, and I think a good retirement system that guarantees that regardless of when I retire, I'm gonna be safe. Should be good for people. I should not have the anxiety to know what I'm gonna do later in life. I will have a pension fund, and at the same rate, the pension fund brings solidarity among peers, because the one that's working is paying for the one that retired. And right now, by doing the 401ks, it's becoming individualized, and teachers are starting to develop a sense of individuality where I do not need my peer to fight for what I'm going to get in the future, because I'm here for myself, and that's the neoliberalist agenda in their heads. So I think that not only retirement, but that individualistic and corporate idealism, where it's you and your mind, the one that have that can make the difference. It's not your reality. It's not that you don't have the resources. Is that you have to get your mindset on. And yeah, you have to get your mindset on it, but you have to give me the resources. And I'll do everything I can because I like teaching. But if I don't have the resources, there's a limit to what I can do. And last but not least, school occupations. Many of the schools that were closed have been occupied by teachers and communities in order to transform them into community service and adult learning places or after school institutions. The reason is twofold. One is because we actually need those types of places where communities get together and organize. But there's another reason, that if you abandon the school will destroy by itself. It got destroyed by itself. If you look at the schools that were not occupied by their communities, they have been dismantled. The poverty in Puerto Rico has driven many people to take out their windows. Those schools have no windows, have no doors, they have no plumbing. Everything that's made out of metal has disappeared. You have a structure made out of cement that's worthless. So that's millions of dollars lost in the economy of schools. And that money has been lost because the communities that didn't take care of their buildings have lost them. Now, with the earthquake, you could go back to a few of those schools, a few of the schools that were closed, if they were properly maintained. And that's the problem, that there weren't kept enough schools open, so that now that we have the problem of school closures and schools that were that collapsed, we do not have options where to move the students to. We don't have schools that are ready to move the students from one place to another. So, in summary, I think that we have to continue the fight against school privatization in all the ways that we can. But I think that the ideological struggle against privatization begins with the struggle against individualism. And sometimes we're taken to seminars, as I said at the beginning, seminars or training. And in those trainings, you see that the content usually is outdated. Teachers actually know more than the presentee, than the person that's presenting. But when you look deep down, what they are trying to actually teach us is not about the content. It's about the individualistic ideology of neoliberalism, of everyone to themselves, of if you have faith, you can do it, and do not worry and do not become one of those that's always complaining, because those are the people, the bad blood people that only want to bring problems. No, you have to solve it by yourself. And that's the thread that you can actually find. I've seen people giving seminars about science, saying things that are totally unscientific, things that have been proved wrong for years. People that are paid probably thousands of dollars for doing 15-minute talks, but they do not know anything about what they're talking about. So I think that struggle is the main one. We as teachers have to do the opposite. We have to talk about solidarity. We have to transform our courses into courses of solidarity, where regardless of what you are teaching, we have to develop a sense of community and a sense of tolerance, respect, that brings people together, regardless of their limitations, their differences, their language. And to me, that's what my role as teacher is. Not only to give the highest quality education that I can, but to transform society, at least motivating students to analyze not only physics, but nature in general and human nature.
Gracias, Hugo. So
Thank you, Hugo.
in the interest of time, any questions that you have for Hugo, we'll put until after the next speaker talks, which I believe is Lisa, Alexandria. Do you want to introduce them?
Thank you so much. So yeah, if you need to go, we understand. Thank you all for being here. Our last and final speaker is going to be Lisa. Lisa Figueroa-Jahn. She is an education officer of New York Boricua Resistance. She's a medical anthropologist who focuses mainly on the impact of disease and displacement on women's health. And she is an adjunct at Brooklyn College. So yeah, and we'll be taking more questions at the end, and we'll also have our recording for you, for those who want to make sure we have their email. So thank you, Lisa.
Okay, can everyone see the PowerPoint? Okay, perfect. I just want to make sure. So I put a link in the chat, and I just wanted to give you the heads up. What that link is, it's a connection to a live reporting map at Johns Hopkins University. So all of the data that you're going to see today, any of the confirmed cases throughout the world, came from that website. So you should feel free to also keep track of that website so that you can see what's going on from a day-to-day basis, and you can see how quickly coronavirus is spreading. So excited, and for the sake of time, I'll try to self-edit as we go along. But I'm going to be discussing a few global examples of what's happening with coronavirus, as well as the United States, which I think is an important conversation when we're talking about Puerto Rico because of that colonial relationship, right? That's really going to impact what happens in Puerto Rico. So first, I will start with just a selective recap, right? So worldwide right now, and this data was from the Johns Hopkins website as of Friday midnight, and I know has actually increased quite a bit. So take these numbers with a grain of salt. But the worldwide confirmed cases are over 500,000. And there are over 27,000 confirmed deaths. The good news is that there are also over 131,000 people that have recovered, right? So we can get out of this, but what it looks like when we come out of it is the question, right? So just to discuss a bit, so I'm not gonna read off the numbers on the slide. You can take a look at that to see how many confirmed cases and deaths there are. But for Italy, for example, the virus has infected more than 5,000 doctors, nurses, and technicians. And these are frontline healthcare workers, right? And if they are becoming ill, if they are not equipped, then they are not going to be able to address the spread of coronavirus. Right? And in total, 41 healthcare workers have died of COVID-19 since the outbreak. medical professionals in Italy have admitted to being completely underprepared and perhaps ignoring the potential consequences. And I think this really maps on to what Christian was saying earlier. Many countries we saw did not step in and even sound the alarm until March, whereas the World Health Organization by February 26 was already declaring a public health emergency, right? So many places didn't take it serious. They thought, this isn't really going to hit us that hard. And this lack of response resulted in where 6% of unit beds are reserved for the critically ill patients only. And these patients are not just critically ill, but they have to demonstrate, quote, a reasonable chance to survive. What that looks like is that older patients are not being resuscitated, right? And they're dying alone. And often their families are notified over the phone by a doctor they've never met before that their loved one has died, right? Because of this experience, Italy has implored doctors in the US, which is now the new epicenter of coronavirus, to take heed of the consequences, right, of inaction and not supporting frontline workers. In over a 24-hour period, in Spain recorded the highest single-day death toll at 738, and that eclipsed China. Spain has often been celebrated as a country with a strong healthcare infrastructure, but due to decades of austerity measures, funding for healthcare was cut, which is what we saw in Puerto Rico, right? Austerity has severely, and this was before the hurricanes, right? Before Hurricane Maria, before Hurricane Irma, right? Funding was cut to Medicaid into hospitals who were having to close wards, right? This meant that Spain's hospitals were overwhelmed. And as you may have seen, right, Spain is now being forced to use an ice skating rink as a morgue until bodies can be burned. The first case of coronavirus was detected in January, right? But a nationwide state of alarm and stay-at-home order was not imposed until March 14th. That's a huge gap, right? And Spain's minister has also acknowledged that there were some things done wrong, right? But there are other spaces that I want to talk about. Like, I'm not going to talk about China. We know those stories, right? But there's other spaces that I think are going under the radar that are important to discuss. For example, Iran, right? It is very difficult to address a pandemic when there are US sanctions, right? So very similar to that sort of US colonial relationship, sanctions are really going to impact how Iran can respond. So what we're seeing is that Iran now appears to be the epicenter of the outbreak in the Middle East, with a higher fatality rate than seen in other places. So you can just look at how many confirmed cases there are versus how many deaths, right? And that's really big. Restrictions on financing imposed by US sanctions have resulted in limiting Iranian companies and hospitals' options for The Trump administration claimed that they would be willing to work with Iran to lift sanctions. But as of last weekend, we saw that Trump reneged as usual and started threatening any country that provides aid to Iran. So I think that what Iran does is that it provides how global and capitalism affect the possibilities for virus containment, right? And we could also think about Palestine, right? We can think about what's happening on the Gaza Strip and the fact that there is barely a healthcare infrastructure. How are they going to respond to this, right? But we also have to acknowledge that, similar to other world leaders, that the Iranian government also denied that there was an outbreak and reacted slowly, right? So you have these things coming together. So for me, I think these examples offer a sort of repeating theme, right? That it's not just a global pandemic, but a global crisis in leadership, right? And this runs the gamut from apathy to spreading misinformation, like Bolsonaro in Brazil, who said, it's just the flu, I'm athletic, I'll be fine, I won't get it, right? To inaction and utilizing police and military forces as public health intervention, right? And we're seeing this in New York as well. Before I move on to discuss the US, I want to talk about South Korea briefly, because they're becoming quite a hot topic right? South Korea has dramatically slowed the number of new coronavirus cases, or what they call flatten the curve, without having to shut down their economy entirely, right? And so as the global economy continues to fall, many countries are looking to South Korea as an example of economic survival, right? So again, it's not people, it's not public health, it's how do we survive economically? Oh, look what South Korea did, right? They managed to stay open. But there's a big difference between what South Korea did and what many other countries have done. And that issue is that there were two key public health responses that made the difference. One involved an integrated aggressive case finding through contact tracing. So contact tracing is essentially when someone was confirmed with having COVID-19, not only did they trace who they were in contact with from the moment of confirmation, but they went back in history and tested every single person that they came into contact with. The second method was once people were found to have COVID-19, they were isolated, but not isolated in horrendous conditions, isolated with proper care. And that's why you see that curve flattening, right? So South Korea has over 300,000 tests per capita, right? That is more than 40 times of what the US has done. But this really demonstrates that the US and many of the other countries who are asking for economic survival really do not have the resources or capacity to implement this kind of public health measure. And so what this means is that what South Korea did is that they were ahead of the virus. So what are we doing? We are definitely not ahead of the virus in the United States. We're chasing the virus, right? We're chasing to figure out how we contain it. So the US is currently overtaking China in confirmed cases. We know that now. The US is the epicenter. Very similar to these countries we see globally, our first case was confirmed in January in Washington, DC. Yet, many states did not sound the alarm until March, when cases in California and Seattle began to surge. This was also influenced by the Trump administration. For 2 months, Trump downplayed the threat of coronavirus, the threat that it posed. And during his sort of press conferences, rather than discuss any sort of approach, he just relied on making comments about attacking reporters saying that they were siding with China if they questioned his policies, racializing the disease as a Chinese virus and a Kung flu, right? And we know that due to those comments and that racialization of a pathogen, that we've seen a spike in attacks, right, against the Asian community in the United States. I can't speak for elsewhere, but definitely in the United States. And so what's happening is that cases are nearly tripling overnight because of US inaction. Rather than getting ahead of the virus, we are chasing it. And this has also resulted in hospitals and frontline healthcare workers, similar to Italy, reporting shortages of ventilators, shortages of ICU beds, N95 masks are being recycled and reused, right? And other personal protection equipment is lacking, right? We have a lack of tests, and we know that the cases will continue to rise. So New York specific. It's important to talk about New York because while New York State has over 46,000 cases, New York City makes up half of those cases, right? And so what does it look like in New York City? What is the response? Allow students to graduate in order to become frontline healthcare workers. But I think that we're already a little too deep, right? Because we already see that hospitals are splitting ventilators so they can treat 2 patients at a time, right? And in some cases, experimenting with 3D printing. We know now that refrigerated trucks and tents are being stationed outside hospitals to store bodies as morgues fill, right? And doctors are really concerned that they're going to be facing the same kind of questions that doctors in Italy are faced with, right? Triage. Who do we let live and who do we let die? Manage it all. Other responses in New York has been to state that the NYPD, so the New York Police Department, has been ordered to enforce social distancing. And this is dangerous for several reasons, right? A, we know that if you're enforcing social distancing and you're getting close to people, and you can spread coronavirus to them, right? We already know that 129 members have tested positive for COVID-19. But the other issue that I think we need to think about is the fact that the police department has a horrible history of abuse and violence towards people that live in low-income communities and people of color, right? And so we have to really think about, when we are asking for an intervention, who is that really going to impact? Because the police are not going to be on the Upper West Side saying, hey, break it up, but in communities of color, right? And in low-income communities, to think of how this is going to proportionally affect some people. I also want to bring up incarceration. And I think that we should ask the same questions for Puerto Rico, right? We know that in Puerto Rico, there are over 10,000 people housed in prisons. How are we caring for those populations, right? If the disease enters those populations, it will spread so quickly because of how they are housed, right? So I'll speak about Rikers in New York. So incarcerated people are more likely to have other pre-existing health conditions, right? And that's going to put them at a higher risk for mortality from the virus. Making matters worse is that already we're hearing in New York where people that are incarcerated are reporting a shortage of cleaning supplies, including the soap that's needed to stem the spread of the virus. Many sleep in crowded dorm-style housing units and share bathrooms, right? And with this sort of order of lockdown, this imposition of a lockdown, conditions are rapidly deteriorating. Now, Mayor de Blasio has announced that they're going to allow 300 nonviolent inmates to be released to slow the spread of the disease. But there are over 5,000 people housed at Rikers. So releasing 300 isn't really going to have an impact, right? Also, of that 5,000, about 2,000 are over the age of 50, right? So that kind of population that we're concerned is more vulnerable. So there are people fighting and demanding to release the prisoners, from grassroots organizations in New York City to public defenders who are petitioning the courts to free their clients. But so far, since this proposal came up, Mayor de Blasio and Governor Cuomo have not really brought it up again and have not addressed it. And I haven't yet seen anything where anyone has been released. So what's a broader response? I love this hashtag and I encourage you all to use it. COVIDiot, that's what we're calling Trump because he's an idiot and he's in charge of COVID response, right? So I love this term. I saw it trending online, and so I thought it was great to have this on my slide. So what has been the larger US government response? Well, on March 9th, while heading to Mar-a-Lago, Trump stopped at the CDC to tour the facility and talk about his administration's approach to handling the pandemic. Of course, and he said about himself, quote, "You know, my uncle, he was a great person. He was at MIT. He taught at MIT for, I think, a record number of years." Trump, I like this stuff. I really get it. People are surprised that I understand it. Every one of these doctors said, "How do you know so much about this? Maybe I have a natural ability. Maybe I should have done that instead of running for president." So this is the person that is in charge of response. And while that quote's innocuous, right? And what many that live worldwide have come to expect from Trump, there are other claims that he's making that in relation to coronavirus that are incredibly harmful, okay? So there's currently no vaccine to protect against COVID-19. Yes, Mount Sinai Hospital is testing plasma, but it is in testing phases. There is no vaccine, right? And yet, Trump continues to claim that the malaria drug, hydrochloroquine and chloroquine, can fight COVID-19. there is not enough evidence to support that these drugs against COVID-19. And in fact, even if they are an existing drug, you would have to still run clinical trials before you can just administer it for a different disease, right? And therefore, because of this, the FDA health officials are pushing back, stating that there need to be a large clinical trial before these drugs can be dispensed against COVID-19. But by promoting this drug, Trump is endangering people. We started filling prescriptions for these drugs, right, based on what he said. And in fact, a man who stated he took this drug to prevent COVID-19 died on March 23rd after ingesting it, right? So we need to be really careful. This is a lot of misinformation is happening because of who's in charge. And so I just another issue that we're having, right? Another government response. And I love this too, right? We're not trading our abuelas for the stock market, right? The idea is we have to save the economy before people. And we see it in Puerto Rico as well, the debt before the people. We have to pay it back, right? So Trump stated, we don't want the cure to be worse than the disease, right? And what he's referring to is the cure being shutting down the economy. Why? Because he wants to lift restrictions and encourage people to return to business as usual by Easter. Well, Easter is the same time frame that health officials stated New York City cases will peak, right? And public health officials are stating that if we go back to work too soon, we risk having more people become ill and having to shut down the economy anyway, right? But this idea has been taken up seriously, right? That we need to sacrifice lives to save the economy. And it was most strongly articulated by Texas Lieutenant Governor Dan Patrick, who stated grandparents do not want to sacrifice the country's economy, and called for elderly folks to sacrifice themselves for their grandchildren's economic future. And that's sort of where this artist was pushing back. Like, I'm not going to sacrifice my grandmother to save your economy, right? And so I thought that was important. So there's a stimulus bill that was passed this week in the US, and I call it a corporate bailout, because while there are some things in there that admittedly would help in the short term, in the long term, it's really going to help corporations. So I'm not you can see the breakdown of what that bill entails, right? But what I do want to point out is that there's a record 3.3 million folks who filed for unemployment last week alone, right? And so we know that there are a lot of people that are losing jobs, right? This were underemployed, right? So yes, when you hear that there is $300 billion in direct cash payouts that are going to be used for direct cash payouts, which is going to pay $1,200 to adults and $500 for each child. This sounds great, right? Who couldn't use that? I could use it. I totally want it, right? But in thinking in the long term, I understand that that amount of money, especially based where I live, is not going to sustain me through this pandemic, right? And so that's what we have to think about, because also within this bill are loans for corporations and big businesses, right? There's also tax benefits for corporations, and those are the people that are going to benefit. So I just want to highlight, what is $1,200 one-time payment going to do for me when I live in one of the most expensive cities, right? So you can look at this map and you can see the different costs of living, right? So that money is going to go away really fast. And then you're still employed. Maybe we're still in a shelter in call. And so what do we do, right? So we need to be making different demands and thinking, I think, a bit differently, right? So while this sounds good and necessary, it is a short-term solution, especially if you live in New York, where minimum wage is $15. And so you can imagine $15 with this cost of living, you're not making it, right? And according to the census data, 1.7 million New Yorkers live below the federal poverty line, right? And we can think about this, that what we should be demanding is a rent freeze, right? No one should be paying rent right now. We should be demanding a cancellation of student debt, a freeze on payments of all utilities, right? And not just here, but also in Puerto Rico, where we know utilities are astronomical, right? Where we also know that 44% of the population live below the federal poverty line as well, right? So some things this bill excludes is important to talk about as well. People, status families, right? So according to a draft of the bill, the relief explicitly excludes those without Social Security numbers from obtaining the one-time cash assistance payments and disqualifies individuals who would otherwise be eligible, but jointly filed their taxes with a family member who doesn't have a Social Security number. This does not mean that they're not paying taxes, right? We know that undocumented folks pay taxes, right? How can they do this? Well, most of them file their taxes using an individual tax identification number, right? So they should have the same rights and the same access to the stimulus bill. And what we should remember is that these are the people that are picking our food, cooking for us, right? Delivering our food to us while many of us are inside socially isolating. These are the folks doing the deep cleaning of houses, offices, hospitals, who are taking care of our very elderly and our very young, right? So I want us to always be thinking about who's being excluded in these bills that maybe we think are really great, right? Migrants and asylum seekers are another population we need to think about in this pandemic, right? We know that there are more than 37,000 ICE detainees in private and local jails, right? Across the US. We know the horrendous conditions that they are housed in, right? We've seen the photos, we've heard the audios of children crying, we've seen this family separation. We know that, and you can see from this photo, right? The conditions that people are housed forced to live in, how is that gonna allow for the disease not to spread, right? In those kinds of conditions. And already we are seeing that 2 detainees and 1 correctional officer in New Jersey have already been confirmed cases, right? So what are we seeing? Well, folks at these asylum centers are fighting back. They're engaging in a hunger strike, right? Have to think about demand, right? That detainees are released, right? And they're actually demanding that. They're saying either release us on bond or deport us to our home countries, which is also very dangerous, right? I want to talk a little about reproductive justice, because we have to think about, in these times, often when there's a crisis, it becomes exploited. It becomes a time to pass policies that really are harmful, right? So one of the things I want to think about is this, reproductive justice. So as hospitals struggle to adapt to dwindling personal protective equipment, and coronavirus is also threatening and already straining maternal health system, many hospitals in New York City stated that doulas, birthing doulas, or spouses cannot be present during labor or birth because of the virus. The World Health Organization does not even include this as part of their recommendations and their guidelines. However, New York hospitals are doing this. We have to think of this in the context that in the US, childbirth is the #1 reason people are admitted to the hospital. New York has been highlighted as having a high maternal morbidity rate for Black women. And you can see it in the graphic there. I mean, we're looking at women, pregnancy-related deaths. Black women die almost 3 times more than their white counterparts, right? That is a major disparity. And in light of this reality, the recent decision of some of the city's hospitals should raise concern about how the barring of doulas and spouses may disproportionately affect populations, such as Black women, who are already vulnerable to disbelief and mistreatment by hospital staff. A situation that can potentially worsen without anyone there to advocate for them. And we have seen a case like this already, where a woman coming from the shelter system, her and her husband, were not taken seriously when she arrived at the hospital with her doula. She felt disempowered. She felt scared. She had no idea what she was doing and was forced to give birth alone, right? And while it's true that clinical providers are facing a shortage of, protective gear, and that does place them at a higher risk, right, of contracting COVID-19. At the same time, it's important to consider the consequences of our choices, right? And imagine a more ethical approach to providing essential, safe, and high quality care during labor and birth, right? And one of those things could be thinking about how do we invest more in home births and birthing centers, right? And domestic violence. So Hugo brought this up, and I think that this is really important, right? Because about the way in which there are people right now that are experiencing domestic violence and are currently sheltering in place with their abusive partners. And I'm not going to get into it, but also child abuse, right? Children that are forced to shelter in with parents that are abusive is another issue, right? There's a strong correlation between domestic violence and crises. So for example, after 9/11, Hurricane Sandy, Katrina, Maria, and Irma, there was a surge. And those unreported.
You
So
cut out a little bit. I'm sorry, Lisa, you cut out a little bit. If you could just repeat the last two sentences.
Oh, sure, sorry. Let's see, where was I? Oh, yes. So I was saying that after crises like 9/11 and hurricanes Maria, Irma, Katrina, Sandy, we saw a surge in reported domestic violence cases. And many of these cases, and we also know that there's a lot that goes unreported, right? So we could assume it's a higher rate. So a shelter in place forces many survivors from their social networks, social support systems, and employment, right? Which can be an escape. And I just want to highlight a few things on this slide, right? So in Puerto Rico, between Sunday, March 15th, when the curfew executive order went into effect, through Sunday, March 22nd, the police bureau received and investigated 141 complaints of domestic violence, right? So we have to think about when we're imposing curfews, right? And I'm not saying that we think about everyone can shelter in, right? And also, I want to bring something else in. Okay, so perhaps the idea is the police, they're there to respond. Well, in the United States, there was a report put together by the investigative reporting program at UC Berkeley that found when they investigated officers that either had criminal complaints and convictions, the most common was domestic violence, right? And we know the same is true for cases in Puerto Rico. Often the perpetrator of domestic violence is a police officer. So now we're talking not only about domestic violence being an issue, but that the people that are supposed to protect you, right, are your perpetrators. And that's going to... Final thoughts. And I have a lot, but I'll try to keep it short. Okay, here we go. So often during disasters, economic recessions, and pandemics, governments exploit crisis to push forward policies that strip away people's basic human rights. For example, Texas and Ohio have stated that abortions will be delayed because they are non-essential. But we need to really recognize that Texas and Ohio historically have been anti-abortion states, right? And this just became an opportune moment for them to impose this kind of policy. Also, a comrade in Puerto Rico on a conference call we had recently informed us that gender-affirming surgery
I'm sorry, Lisa, you're breaking.
What is
you're
essential?
breaking up.
You cut out again, Lisa. I'm sorry.
Oh, sorry. I don't know where I left off.
Gender affirming surgeries. You're talking about gender affirming surgery.
Oh, awesome. Okay. So gender affirming surgeries are being delayed because those are also considered non-essential. So I'm posing, like, who gets to decide what is essential? Do I want to be pregnant during a pandemic, right? What about gender affirming surgery, right? So these are all important things. So my thing is that we must remain vigilant even in these difficult times, when the numbers are demonstrating that COVID-19 is going to devastate our people, right? We need to be vigilant because this pandemic has the potential to normalize and expand the surveillance state. The militarization of police forces that are endowed with impunity, the restriction of movement and freedom of speech, right? Through these ideas of curfew enforcement. And I want to go back to something Hugo said. These are not public health measures. These are neoliberal ideas. If we impose the neoliberal idea of self-modification, modify your behavior, what we're actually doing is saying that you are responsible for the containment of the disease, not the state. It's on you, right? That is not a public health response. That is neoliberal ideology, telling you that you need to self-discipline, right? And I think that's important. And all the while, what we're going to see is that there's going to be a favor for market-based solutions that are disguised as public health measures, right? And in the United States, example, we already see this. The Environmental Protection Agency on Thursday announced a sweeping and indefinite suspension of environmental rules, telling companies they will effectively be allowed to regulate themselves during the coronavirus pandemic. This tells companies across the country that they will not face enforcement even if they emit unlawful air and water pollution in violation of environmental laws, so long as they claim that those failures were pandemic.
You cut out again. I'm sorry. You said those failures were.
Oops. Okay, so they do not have to follow any of the law enforcement as long as they can claim that the failures were caused by the virus pandemic, right? So my question again is, how will this impact Puerto Rico, home to over 20 antiquated Superfund sites, where communities neighboring Las Cenizas, right, the coal ash, report high cancer rates, where over 700,000 people have asthma, and there continues to be a struggle for clean water, right? This idea that we can separate health from the environment is incredibly dangerous, right? Because our health is entirely dependent on the climate and the other organisms we share the planet with, right? So my final question is, the question I want to raise is, while the virus may require restrictions on movement, right? Stay home, physical distancing, how we enforce these and who we target is key. Because what happens, what kind of society emerges when this passes, right? And so my last slide I would leave here as just a collective we. I think the way forward is collective, which we've already seen so many in Puerto Rico and in the diaspora. We are going to have to make demand, not communication, right? Dialogue, because dialogue really is signaling that it's an encounter between people, right? A collective practice where we educate each other in order to create and transform the world, right? Because liberation is going to mandate that we struggle in collaboration. And that has to be self-consciously political, right? So again, thank you everyone for sticking around. I know we went over time, but I really appreciate it.